Hello friends, hope you all are fine and doing well. Stay home, stay safe. Today is the 11th day of the lockdown, COVID-19 lockdown. So in the series of our online lecture, today we'll start the discussion on uh, drugs acting on nervous system, both autonomic nervous system and central nervous system. So before starting of discussion of different types of the drugs acting on nervous system, uh, we should know the basics of the nervous system that already we discussed in classes of anatomy and physiology. Near about 12 billions of the neurons are present the brain, 100 millions of the different types of the circuits are present as the stars in the galaxy. The different types of the circuits are present in your brain. How the coordinated neurotransmission takes place. We must know what is the neurohumoral transmission, what are different types of the neurotransmitter, what are the important types of the receptors are present in the nervous system, both in autonomic nervous system and central nervous system. How the neurotransmission takes place. We know that different types of the ions are present across the plasma membrane, neurolemma of the neurons, sodium ions, potassium ions. We know about the chemical gradient, concentration gradient, electrochemical gradient, how the sodium ions come inside of the membrane, potassium ions go outside of the membrane, different types of the channels, ion channels are present, voltage gated ion channels are present, the role of the channels, which leads to the generation of action potential, nerve impulse, then generation and transmission of nerve impulses. All those things we discussed in detail. What is depolarization, what is repolarization, what is hyperpolarization, when there is a depolarization, transmission of the nerve impulses, what is synapse, what is ganglion, what is pre-ganglionic neuron, what is post-ganglionic neuron, when there is a generation of action potential in the axons of the pre-ganglionic neuron, it transmits the impulses at the synapse. From the synaptic cleft, there is a transmission of neurotransmitter from neuron A to neuron B, that is pre-ganglionic neuron, to the synapse. From synapse, there is a transmission of the neurotransmitter. Then this neurotransmitter, first there is a, depending on the type of the neurotransmitter, if it is excitatory, it starts the excitatory post-synaptic potential. If the neurotransmitter is inhibitory, it leads to the inhibitory post-synaptic potential, that is hyperpolarization. First one is the depolarization. Then activation of this post-synaptic neuron or the post-ganglionic neuron leads to the inhibition or excitation of the targeted cell. So this all those mechanism in detail we discussed in anatomy and physiology. Please go through it. So you should understand what are the different steps, what are the different mechanisms are involved in the generation of action potential, what are the different types of the neurotransmitters are there. We'll discuss also here. But you should also know the basics which we discussed. Please go through it. And then we start with the divisions of the nervous system. So central nervous system, as we know that the nervous system is divided into two parts, central nervous system and peripheral nervous system. Then again peripheral nervous system divided as a somatic nervous system and autonomic nervous system. The central nervous system involves the brain and the spinal cord. Now whatever the nervous tissues are now present in brain and spinal cord, they are fall under the central nervous system. And whatever the nervous tissue are present outside this brain and spinal cord, they fall under the that is peripheral nervous system. So all the nervous tissue present outside the brain and spinal cord, they fall under the peripheral nervous system. Autonomic nervous system is also known as the visceral nervous system. है ना, viscera का organ से deep seated organ से उसको regulate करता है mechanism. Although it is under control of CNS, that is hypothalamus, brain stem, etc. They control the activities of this ANS. So we'll discuss one by one the division of ANS, sympathetic nervous system, and parasympathetic nervous system. Adrenal medulla also has very important role. Then different types of neurotransmitters and receptors in the ANS. All those points we'll discuss in our today's discussion. The human internal environment is regulated in the large measure by the ANS and endocrine glands. We know that the homeostatic mechanism of the human body is regulated by two main systems. The two main systems is the endocrine system and the nervous system. So endocrine system through hormones, release of hormones, it regulates the different internal activities of the body. But the actions of the hormone or endocrine system is very slow. So slow regulating system is there. It is known as slow regulating system. but the actions of the nervous system, they are very quick, they are fast, because they generate the electrical impulses. So this is a fast regulating system. So integrated activities of the two systems are responsible for regulation of homeostasis in the body. The subdivision of peripheral nervous system that regulates the body activities independently, that is autonomously and continuously without conscious effort. सोचना नहीं पड़ता हमको. आपको मैंने कई बार कहा कि हमको सोचना नहीं पड़ता. वैसे बहुत सारी एक्टिविटीज, फॉर एग्जांपल एड्रेनल मेड्यूला से एड्रेनलिन रिलीज हो रहा है, तो हमको सोचना पड़ता है कि दिमाग से सोचने की वजह से चल जाओ भाई हार्मोन जाओ वहाँ पर, न्यूरोट्रांसमीटर जाओ वहाँ से एड्रेनल मेड्यूला से हार्मोन्स रिलीज करो या फिर आप न्यूरोट्रांसमीटर रिलीज करो. सोचना नहीं पड़ता. सबकॉन्शियस लेवल पे हमारे जो है तो रिस्पायरेशन चल रहा है ना, कॉन्ट्रैक्शन रिलैक्सेशन ऑफ द इंटरकॉस्टल मसल्स आर गोइंग ऑन, डायफ्राम इज गोइंग ऑन, सो दैट आर सबकॉन्शियस लेवल है ना, ये ऑटोमेटिकली सबकॉन्शियस लेवल पे काम चल रहा है. सो जनरली दे आर इनर्वेटेड बाय द ANS. Generally this ANS innervates smooth muscle, cardiac muscles, glands, different glands, example sweat glands, salivary glands है ना. जैसा कि हमको हार्ट रेट के बारे में सोचना नहीं पड़ता, हार्ट मसल हार्ट कॉन्ट्रैक्ट हो जाओ, हार्ट रिलैक्स हो जाओ है ना, स्मूथ मसल आपके पेरिस्टाल्टिक मूवमेंट चल रहा है इंटेस्टाइन्स के अंदर, तो सोचना नहीं पड़ता है हमको, उसके लिए स्पेशल दिमाग लगाना नहीं पड़ता है, वो ऑटोमेटिक सबकॉन्शियस लेवल पे काम चल रहा है. तो ये सबकॉन्शियस लेवल के काम जो हो रहे हैं ये इसको ANS रेगुलेट करता है. So this is the division of nervous system. Central nervous system, as I told you, consists of brain and spinal cord. Peripheral nervous system divided in two parts: somatic nervous system and autonomic nervous system. Somatic nervous system generally it supplies the nerves to the limbs, walls of the body, the skeletal muscles of the body. So afferent and efferent neurons, and somatic afferent and efferent sensory and motor neurons regulates the activities of this somatic nervous system. Then autonomic nervous system has two divisions: parasympathetic and sympathetic. As the acetylcholine neurotransmitter is involved in parasympathetic system, the main neurotransmitter, therefore is cholinergic. You know, as the cholinergic nervous system. Sympathetic nervous system is the adrenaline and norepinephrine. Adrenaline ये main neurotransmitter है, इसलिए इसको कहते हैं adrenergic. Please remember it. acetylcholine है यहाँ पर, इसलिए parasympathetic को कहते हैं cholinergic. यहाँ पर adrenaline है, इसलिए sympathetic कहेंगे हम adrenergic, है ना. इसके रिसेप्टर्स है अल्फा रिसेप्टर्स है, अल्फा 1 अल्फा 2, इसके रिसेप्टर बीटा 1 बीटा 2 बीटा 3 रिसेप्टर्स है. पैरासिम्पैथेटिक के अंदर रिसेप्टर्स होते हैं आपके मस्करिनिक और निकोटिनिक. सो दिस इज द सेंट्रल नर्वस सिस्टम. तो हाईलाइट किया देखो, ब्रेन एंड स्पाइनल कॉर्ड, इट इज द सेंट्रल नर्वस सिस्टम. पेरिफेरल सिस्टम ये तो दिख रहा है पूरा, जहां पर भी पूरी बॉडी के नर्व्स और न्यूरोट्रांसमीटर पूरी बॉडी के अंदर फैले हुए, दैट फॉल्स अंडर द पेरिफेरल नर्वस सिस्टम. सेंट्रल नर्वस सिस्टम एंड ऑल दोस आर द पार्ट्स ऑफ द peripheral nervous system. So this is the interrelation between the CNS, ANS, PNS and the sensory division, motor division of the PNS, then autonomic nervous system. These all are the interrelation between the nervous system. So the nervous system mediates the visceral reflex responses that are involuntary and largely unconscious. है ना. ANS का काम क्या है? Generally जो visceral reflex responses है ना, एसिड का सिक्रेशन होना पेट में, पेरिस्टाल्टिक मूवमेंट होना, हार्ट रेट बढ़ना कम होना, रेस्पिरेशन का रेट कम होना बढ़ना, ये सारी चीजें विसरल रिफ्लेक्स रिस्पॉन्सेस है जो ANS कंट्रोल करता है. इनवॉल्यूंटरी है एंड लार्जली अनकॉन्शियस लेवल पे ये रेगुलेट होते हैं. ऑल्दो सर्वाइवल इज पॉसिबल विदाउट ANS, द एबिलिटी टू अडॉप्ट टू एनवायरमेंटल स्ट्रेसेस एंड अदर चैलेंजेस इज सीवियरली कंप्रोमाइज्ड. अगर इससे पहले बताया था आपको कि अगर एड्रेनल मेड्यूला निकाल दिया गया, जो सुप्रारीनल ग्लैंड है, जो आपके किडनीज के ऊपर जो ग्लैंड्स लोकेटेड है, अगर वो बॉडी से निकाल दिए गए तो क्या इफेक्ट होगा, ये हमने ऑलरेडी डिस्कस कर चुके हैं, तो उसका इंपॉर्टेंट क्या है. The ANS autonomic nervous system affects the following. क्या अफेक्ट करता है ये? हार्ट रेट अफेक्ट करता है, रेस्पिरेशन रेट, डाइजेशन, सलाइवेशन, परस्पिरेशन यानी स्वेटिंग जो होती है, स्वेट पसीना निकलता है वो, डायमीटर